Hello everybody and welcome to our 14th Community Weekend. Thank you so much to attending, both to everyone here in person and for those people that are joining us online. Before I go on, just a quick safety note. There are no planned fire alarms, so if it does go off, it's real. And if you make your way to the lobby, and staff will assist you to get down the stairs, including those with disabilities or mobility problems. And the toilets are located out there, and just over there will be teas and coffees for the break and a few snacks. So can we ask that you all switch your phones to silent during the presentations and workshops, or for those with children at the activities to vibrate. I'd like to start our weekend by giving you a quick update on what we've been doing the past year and an overview of the year to come. So I'm immensely proud to say that demand for our services has increased significantly, and this slide demonstrates how awareness of Alex TLC has grown in the past 4 years. We feel that this is in part due to the IWMD service, who regularly refers patients and their families to Alex TLC, alongside our new website and investment in search engine optimisation, helping us to be more visible online. And of course, more beneficiaries means more support requests. So we are carefully monitoring support staff workloads, especially for our lovely Karen. So this slide further demonstrates the improvements we've been able to make in online visibility. Staff have been working really hard on our social media, trying out new ideas, engaging in consultancy and training, and you can see here just how well this has improved our engagement statistics. And similarly, our communications are opened by 41% of our community, well over the sector average of 29%. And our new website has seen user numbers go up by nearly 60%. The dip in the 2022 and 23 years is due to the change in the cookie rules where you can opt in or opt out. So this is all the good stuff. In terms of our charitable work and activities, everything is going really, really well. More people are finding us, with beneficiary numbers increasing by 64% year on year, and the number of support requests increasing by 27%. Our communications are well received, and over 75% of respondents to our 2024 impact report said that Alex TLC helps reduce isolation, provides the best information and support, and helps them cope with their condition. So we're representing patients within the NHS and Europe-wide through the European Reference Network. And just to corroborate the value of our work, these are just some of the quotes from our 2024 impact report, demonstrating how our support and information are improving the lives of people affected by leukodystrophy. And you know, these just really make us and our staff know that we're doing a good job. So thank you for those of you that have responded to our questionnaires and surveys and said such lovely things about what we do. So everything's going really great, yeah? Well, not really. We have hit a stumbling block in terms of the challenges facing the charity sector this year, challenges which we don't think are going to go away very quickly. The cost of living increases are affecting how people spend their money, donations down in general from the public and companies, and there is incredible competition for grants, mainly caused by cuts to government and local authority funding. So those charities that could rely on these sources of income are now going for the same pots of money that we are. The biggest challenge by far is the financial burden that increases to employers' national insurance has caused across the sector, which won't change without a government U-turn. And the House of Lords has already been petitioned to exempt charities from these rises and rejected the motion. So we're not alone in these challenges, and it's quite disturbing to see how others in the sector have had to cut staff and services in order to survive, and this is not a position we want to find ourselves in. I would like to think that the collective voices of so many concerned charity leaders and organisations might effect some change to improve things, but I'm not entirely sure that we can rely on that. So how is this affecting Alex TLC? So the chart on the left shows year-on-year growth per income stream. and we have 4 different income streams. We have donations and fundraising from people like yourselves and the public. We have grants, which are grants and trust fundraiser managers. We have our lovely corporate supporters that some of you will have met and are here today. And we have profits from our retail shop. So as you can see, we've experienced steady growth up until our 23-24 year. But since then, donations have more or less flatlined and retail profits have been decimated by the additional burden of the salary cost raises. And so although there's been a year-on-year rise in grants and corporate donations, you can see in the chart on the right that grants and retail profits were significantly below the targets for the year. And this reduction in income brings with it challenges, especially when we have growing numbers of beneficiaries to support. Rising costs is sadly something that we have no power over. However, we can try and improve our income levels. So we've been concentrating on a thorough assessment of our retail business, improving how we apply for grants, and building relationships with the funders supporting us. We've given our fundraising team extra resource to do more work, and we're constantly thinking up new fundraising ideas like our 50-50 draw. We've also met with our wonderful corporate supporters to see how they might be able to help us. So we're not sitting by waiting for the worst to happen. I'm always wary of putting too much pressure on the very people that we seek to support, when I know firsthand just how difficult living with these devastating conditions is. However, in these challenging times, I'm going to have to stick my neck out and say if you can help us, even in a very low impact way, like sharing our social media posts with your own networks, signing up to easy fundraising, please do. If we're going to continue delivering our work to the current standards and grow to meet increasing demand, we're going to need a little bit more help to get us through these tough times. So I'm truly sorry to have to start the weekend with a lecture on our finances. Oh, sorry, I can't move down. But the situation is serious and can't be ignored. So all I ask is that you do what you can, and you know, whatever level, every little bit helps. I think that's somebody else's catchphrase, but I'm going to borrow it for today. So that's all from me. I'm going to hand you over to the lovely Karen now. As usual, I'm very short and sweet. So I think I've given the other presenters a bit more time. Okay, thank you very much.